So now that we have done how the wave of depolarization and the repolarization moves in the entire atrial muscles, it's time to study the same concept on the ventricles. Okay, starting with depolarization of the ventricles. Now, before I explain further, it's important to know that the process of depolarization is different in the ventricles when we compare it with than that of the atrial muscles. And the reason for that being, in the atria, like if you talk about the atria, the sinus node is going to generate the impulse, and then the movement of the impulse, as we did previously, is going to be circumferential. It's going to move from one muscle cell to the another muscle cell. Okay, but in ventricles it's a little bit different. You have AV node, bundle of hairs, right and left bundle branch, and then you have Purkinje fibers. Okay, so this conduction system is something that is not present in the atria. Hence, in the ventricles, the conduction is first, the impulse is first conducted through this conduction system until and unless it's going to reach the Purkinje fibers, which is the terminal part of the conduction system, and from the Purkinje fibers it will reach the ventricular muscles. Okay, so this is something that's not there in the atria. The sinus node is directly going to stimulate the atrial muscles, but in the ventricles, the impulse will first be conducted through this conduction system, and then it will come to the ventricular muscles. Okay. Another concept that needs to be cleared here is that the wave of depolarization in the ventricular musculature goes from endocardium to the epicardium. Just like you can see here, okay, it's going from the endocardium to the epicardium. So the heart has three layers. It's going to have the endocardium, then the middle layer is going to be the myocardium, and the outermost is going to be the epicardium. Now, what is the reason that the wave of depolarization is going from endo to the epicardium? The reason for that being is that the Purkinje fibers, they lie in the subendocardial location. Now, if you see these branches, these are actually the branches of the Purkinje fibers. So the Purkinje fibers terminate in the subendocardium location. Therefore, the endocardium would be the first area to be stimulated. Then we're going to have the myocardium and then epicardium, and that is why the vector is from in to out when you consider the layers of the heart. Okay, so the depolarization vector is always from endocardium to the epicardium. Now that we know that the depolarization moves from endocardium to the epicardium, if you keep an electrode here, like let's say that we have a recording electrode V5. Okay, let's say that this is the left ventricle that we're talking about, and this is the V5 electrode. If you keep the V5 electrode here and try to record the deflection, you're going to actually have a positive deflection. Why so? Because the ventricular vector here is something like this. It's directed from endocardium to epicardium, the reason of which we have already discussed. And why the arrowhead is positive? It's positive because it's actually indicating the spread of the positivity. That is why the arrowhead is positive. Now, if you keep a recording electrode here, the recording electrode is facing the positive side of the dipole, hence the deflection is going to be positive. Okay, so these were some of the concepts.